Good morning, good afternoon, and good night for everyone. On behalf of my partner Flavio, I'm opening this session because he's still on the main stage, closing the healthcare session. Well, I'm Fred Pinto. I'm a medical oncologist, and I'm involved with Elitania Pontes, that is also an oncologist, and we were been working together in a project named Previna Project for uh, I think over 3 years. I think it is, yes, Elitania. So and I'm just getting somebody into the room. And so the project is based on creating more access to cancer patients. So Elitania works with the Public Healthcare Authority. She's the physician responsible for this project, and also the chief architect of it. Just okay. I will share with you my screen, and we'll show you a video. So Elitania, welcome. I got the chance to let you introduce yourself, please. You're on mute.
Okay, thank to be here. I'm very pleasure to be here in this event. And my name is Elitania Pontes. I am a pediatric oncologist, and I work at the public health secretary of my city, São José dos Campos, as a manager of this program, Previna, which cares the oncology patients and flows. Okay.
Great. So I will share our presentation, that it's pre-recorded, and then we will be back at the end of it. In cancer care in São José dos Campos from 2000. I'm sorry. Well, we're presenting.
Hello, my friends. Can you hear me? Hello? Hi, Litania. Can you hear
Hi.
me?
Yeah.
Oh, thanks. I was a little bit late.
No problem.
Did you start
Pleasure
already?
to meet you. No, Fred is trying to put the video.
Fred, would you like me to try? I cannot hear you for some reason.
Well, the video is not being shared. I'm not sure about it.
Okay, I can try do it here.
So please do it.
Yeah, just a moment, please.
Because I got a screen shared for me.
Let's see if I can share the screen. Just a moment. Can you see my screen? Is that okay? Can you see
No.
now?
No screen.
No
It's
screen
okay?
at all.
No.
No.
Not? Just a moment. So let's see how it goes. What about now?
Yes.
Okay.
No.
No?
Sharing, but
Yeah.
no sound.
So it's not possible for you to watch.
No, it was okay, but it was not playing.
With the sound?
No sound.
Let me try again. Sorry about that. What about now? Is it running? Can you listen?
No.
No sound.
No.
No sound. Roberto, eu preciso de ajuda. Just a moment, I will check if there's something here we can
Let's do this.
check it. Just a moment, please.
We were worried about connection quality, but
Yes, I've had some technical support here. Let's see if we can solve it.
then I can try to make it live if you want to.
Just one moment, I will try it again.
Yeah. I think we can go live, Flavio.
Can you hear now or not?
No audio.
No audio.
Audio.
So let's abandon this. Let's go live, Fred.
Yeah.
Sorry about that. We've tried to do it one way, but we used to do PDCA all the time, so we're going live. Fred, can I just introduce you? Like, sorry about that. It's very quick.
I already introduced myself.
Oh, so you can go, my friend. So that's you're from home. So just keep
And I
moving,
also
please.
introduced Elitania,
Thank you
and
very
also
much.
thank you, Lisa, for being with us for this transition. So
Sorry about
actually,
that.
what I'm talking about is about the extended value stream in cancer care, the Previna project, led by Elitania, that is with us this tonight here in Brazil, but whatever it is in this morning or this afternoon elsewhere. But the point is that we at IOV, we are worried about reducing the burden of cancer among us all. And the value strategy of IOV involved creating a value stream that improves the experience of care, reduce the cost of care, improve population health care, and improve work process using PDCA in the format of an A3. So that's our strategy, and that's the way we try to work. And when we started doing like this, we had a problem to solve. Well, what was the problem that we have at that point? Well, the problem at that point is that patients were facing long waiting lines for get access to cancer care. So in 2018, we started a project with the City Healthcare Authority, trying to improve the quality of care. And at the same time, we joined the specific track of this project, the Previna project, that is Elitânia is the leader, and we started working together. So at that point, we had a basic idea about what we were expecting to be done. Well, thinking about creating a culture for an organization like the City Healthcare Authority, it's a more than 700,000 inhabitants city. We were thinking about creating escalated daily management, creating leadership discipline and ways to develop leaders, creating problem-solving capacity, standardized processes, and visual tools for everyone. So this is the vision of our OBEA at the City Healthcare Authority, creating a shared vision for the leadership behavior, using plans and tracks, and using a lot of cross-pollination between the IOV and the City Healthcare Authority. I was just talking about cross-pollination, the session just a few minutes ago. How to sustain it, how to create long and short-term goals. And that point was based on the 4 major projects that Previna was one of them, and how to create a way to navigate the system for checking and adjusting for the future. And these are some samples of what we did. So for the blood sampling collection and blood sampling capacity almost doubled with minimal effort, and the time to deliver results was gone from 7 days to just 1 day. The work done with the supply chain and the way they created new ways to provide and support their system. I mean, what I want to say, to support and provide supplies for the primary care units changed dramatically. So we got like stuff being held for weeks on this condition, and with little ways to get any improvement to this. So pharmacies are now organized as a point of use units, and not just as big packs of material and medication and pills and whatever. So this is the last one. This was like just last month in the primary care unit that we are working to create what we call the model line. What was good about this great improvement in the supply chain is that they saved a lot of money. And with the money saved, they were able to create space for hiring more doctors or more nurses or more healthcare professionals to provide better care. So what we did, and the plan that we developed, was very simple. It was based on A3 problem-solving dedicated team on Gemba, thinking on daily management, and Q discipline, organizing the system in the fast track, regular track, and special track. With this redesign of the flows, they were able to reduce time to access to specialists in almost 50%, as well as increase the number of available slots for those patients. So with 1% increased capacity, they were able to improve almost 50% of their available slots. So what happened to the Previna project is that cancer is the second leading cause of death. Cancer patients were facing long waiting times, and some specialties had waiting times to access longer than 1 year. So we specialties like urology had no dedicated access. So we created a timeline from 2018 to 2019, we redesigned the chemotherapy flow. 2019 to 2021, the Previna was created as well, with a project that we call the pilot project, the prostate cancer flow redesign, at the same time with the daily management for all cancer patients. But when we're creating room for those prostate cancer patients, we needed to create room in the radiation oncology flow. So we had, because most of those patients goes to radiotherapy. And the big challenge for us in 2021 to 2022 is sustain the results in pandemics. And Elitânia will show you part of it. I will show just the beginning of it with the public cancer center, when we redesigned the queue waiting lines for those patients, and fast track, regular track, and special track, creating product families. With this new flow, we were able to create a transition process for the people involved, for the team. More than 10% increase in personnel only. We're able to almost then double capacity, from 430 patients being treated monthly to 928 patients being treated monthly. At the same time, we did the redesign of the flow in radiation oncology and eliminated completely the waiting line for patients getting access to radiation oncology treatment. Creating room for urgent patients, creating room for breast cancer patients, and for prostate cancers, urgent, the fast track and regular track, that Elitânia will share with us right now, because I'm now passing the baton to Elitânia. Please, from this point, I think it's you, Elitânia. Join us.
Okay, thank you. So our goal in prostate cancer, we redesign our flow, because our patients waste a lot of time to be in treatment, and the rationale for these patients were that patients aged between 15 and 79 years old with PSA over than 10 have 67% chance of being carrying a prostate cancer based on the literature data. The patients with elevated PSA had no special flow to access urologists and to get a prostate biopsy. The waiting time to access a neurologist was over than 180 days. And 100% of patients with PSA over than 10 should be biopsied if not contraindicated for other medical issues. So the redesign were that these patients considered high risk were assessed by a clinician, and a biopsy was indicated in our primary care, with not evaluated by urology. Patients considered low risk with PSA 4 to 10 were evaluated by a neurologist in a special track. From April 2019 to September 2020, 277 patients were biopsied in the fast track. And the results, we had 54% were positive for cancer, not as predicted by other studies, but 72% had aggressive prostate cancer. So with this redesign, with this flow, we have from 2016 to October 2020, we almost doubled our percentage of patients with treatment under 60 days, less than 60 days. The other one? Okay. In our Previna project is grounded in 4 major actions. The first one, the process redesign. So to better connect several different providers in several different organizations under an oncology supervision by myself, daily problem solving for teams involved, active surveillance of high-risk tests like PSA, mammogram, biopsies, colonoscopes, PAP smears, and manage daily flow and prioritization using visual tools. Here we have my assistant, Joanna, and this is our principal visual tool. The second one, the second major action is escalated daily management system. So we have daily catchable with primary, secondary, and tertiary care providers, weekly catchable with oncology care providers, and biweekly huddle for global performance with City Healthcare Authority for All, with my boss. The other one. 3. The third one, open communication channels. Then we had a hotline with the flow manager for 46 primary and other secondary care units, specialized decision support by phone with an oncologist, myself, and the strategy deployment. And the fourth one, emergency access and flow with standardized emergency access routines. Okay. The Previna results between 2018 to 2020 are that cancer diagnosis increased substantially even during pandemic period. Access to care before 60 days of diagnosis almost doubled from 2017 to 2020. The flow improvement reduced time to access breast cancer immunohistochemistry from 38 days in 2010 to 4 days in 2020, and this is a very good impact on the treatment and the time treatment. And the hotline answered more than 2,500 demands up to December 2020, coming from primary and secondary care providers to improve patient access and flow. So here again, we have our results between 2018 to 2020. We could see that in this period, especially this one, we have almost increased our treatment between up to 60 days, comparing to less than 60 days. Okay. So during the cancer care in our city during COVID-19 pandemic, that our hospital, our oncology hospital called PIL-12, was designated a COVID-free hospital. So we had no COVID patient admission. The elective surgery suspended only 3 weeks during the initial phase of pandemic, the panic days. We transfer COVID positive patients to other facilities. We had significant decrease in secondary care procedures, biopsies, CT scans, and other procedures, and QE management to provide access to high-risk patients. So in our country, we had a 77% reduction in cancer diagnosis in Brazil during pandemic period. But in our city, in the same period, we had only 20% reduction in cancer diagnosis with our program during this period. So our challenges for the future are that COVID-19 pandemic reduced volume and access to care due quarantines and limited resources. Sustained improvement is dependent on leadership and team's commitment to keep all all elements combination active. The leadership, development, and discipline are crucial for a project like Previna, and a cultural shift usually requires more than 5 years of stable process. That is, thank you for your attention.
Thank you very much, Elitania. Thank you very much, Fred. I think we have a couple minutes to some questions. And now you can hear me. Is that okay?
Yeah.
That's okay. Perfect. So I would like to make a question for both of you because I know you're in the middle of a lot of challenges. And I would like to connect with the previous session that we just had. So what is your next move and why? What are you going to do next? Maybe Fred can start, or Elitania, each one of you, please start.
Well, the boss is Elitania, but I can give a clue.
Yeah, you are my leader.
I think that the big challenge and the next move around here is really to sustain what we achieved. Because actually, it's not about a movement; it's about creating more standards for what we're doing. Because actually, the work that Elitania and Joanna are doing together is amazing, and they did a great job during pandemic. Because we're expecting a catastrophic result during these days, but they were able to sustain with the support of the City Healthcare Authority. They were very supportive. We can use this opportunity to leverage what we're doing and create much more standards on what's happening, so it will be sustained over time. And I think that's the next move. And we've been talking about that, me and Elitania, how to create TWI for the activity and how to create better standards to sustain it in the future.
Great, Fred.
Yes.
Thanks.
What I want to say is that this project is a very hard work, daily work, a very hard. Principally, the sketchball with the primary and secondary and tertiary, and we have a very good support from our authority, health, because we had very easy communication with him and with her. But the mailing goal is to sustain that with the others ones who will come after this. This is our principal management.
Great, Tanya. So thank you very, very much for your participation. Unfortunately, we had some technical problems here, but what you did alive, which was amazing. Thank you very much for sharing what you have learned together, because it's a combined journey. You're learning with IOV, learning with Dr. Fred, and Dr. Fred is doing an amazing job in terms of cross-pollinating, in terms of involving more and more organizations and the city. All authorities, they're talking about me. So what Dr. Fred did for IOV is something amazing, and what he's doing now for the society is even more remarkable. So thanks, Dr. Fred, for being a spreader, for bringing someone who keeps inspiring us, and thank you, Elitania, for open doors, for open mind, and to bring this to your city and to your citizens. This is what we would like to see in more and more countries and more cities. So that's why we believe that your participation here is the key to inspire more and more people. Thank you very much for both of you. Thanks for what you're doing for us here in Brazil. We really appreciate that.
Okay, thank you.
Thank you.
Thank you very much.
Thank you.
Thank you, Lisa. And sorry for the bugs here at the beginning.
Bye, Elitania.
Bye, bye.
Bye, friends. Have a great evening.
Bye-bye.
Bye-bye.